Hi and welcome to Let's Talk. Padma Shri Dr. Philip Augustin is one of India's leading gastroenterologist and healthcare administrator. He is known all over the country and abroad for his expertise in gastrointestinal endoscopy and research in pancreatitis and pancreatic cancer. So let's talk to the MD and CEO of Lakeshore Hospital, Padma Shri Dr. Philip Augustin. Hello and welcome to Let's Talk, sir. How did the idea of setting up such a multi-speciality hospital come into the mind?
See, I was practicing medicine in Kerala for nearly 25 years before I started the work on Lakeshore Hospital. Initially, I was in a small town called Kuttatukulam. Then for 10 years, I worked in Cochin. That was a time in the 90s and 2000s. The technological advances in medical field rapidly happening. And gastroenterology as a specialty had a lot to gain from the technological advances. An important thing was endoscopy. Then there was ultrasonography, CT scan, MRI scan, all coming up. And these facilities were lacking in our state. And some of the patients were even referred outside the state for these facilities in my practice. So I knew if we don't get these world-class amenities, the practice of modern medicine in Kerala would suffer. So the idea of having a world-class facility for modern medical treatment, coupled with the availability of expertise, made me think and jump into such a project.
What makes Lakeshore Hospital different from other multi-speciality hospital in the city?
Yeah, we take pride in saying that we are a little different. I am also a beneficiary of the technological advances. Even though I am not a radiologist, way back in 1984, I went to USA and got trained myself in abdominal ultrasonography. That made a tremendous difference in the diagnostic possibilities of gastrointestinal diseases. So I wanted such similar world-class facilities to come in. We have 35 clinical departments. Most of them are headed by well-known personalities. And we could bring in technologies first time in the state, ahead of others. For example, we were the first to do living donor liver transplant in Kerala. We were the first to insert insulin pump in South India. We were the first to do a joint replacement surgery with a material called metal on ceramic for the first time in the whole of Asia. And right from the inception, I knew, I was watching the healthcare scenario around when I travel a lot, and we knew that there were countries where the medical facilities and systems were failing. For example, the National Health Service of UK, they have a long waiting list. And everybody knows about the American system. Now the new president is trying to revive the whole healthcare. So people have insurance there, but we thought, all the Americans were covered by insurance. Only 40%, about 40% of Americans did not have insurance, to our surprise, when I studied the scenario. So we knew people will come from overseas for treatment here. So we have these facilities and we are looking at new technologies coming in. Only the last week we introduced what is called spyglass cholangioscopy and pancreatoscopy. That's an advanced endoscopic treatment system for bile duct and pancreatic diseases. You can diagnose early and even treat some cancers without surgery.
Could you please tell us something about the world-class facility that Lakeshore has?
To call it in one word, this is a truly global healthcare facility we are offering. That includes the infrastructure, looking at the rooms, the high-end suites, and even a presidential suite for VIPs when they come for any emergency treatment. We have facilities to treat them with all facilities in the room itself. So that kind of facility we have. We have different departments excelling in their own field. So for example, in my department, which is gastroenterology, we have the facility of a world-class gastroenterology center, which includes an advanced endoscopy department, which can cater to the needs of people with the latest technology. We have things like double balloon enteroscopy, that is looking into the small intestine. This is a new introduction. Earlier people used to see the upper gastrointestinal tract with the gastroscope, the lower tract with the colonoscope. A direct visualization of the 22 feet of intestine was possible with the double balloon enteroscopy. So we sent one of our senior gastroenterologists to learn this technique from the originator of this technique from Japan. So we implemented that for the first time. Also we have the wireless capsule endoscopy. For example, if there is an obscure bleeding inside, you swallow a camera the size of a big capsule, and the camera will work for 8 to 10 hours. Meanwhile, it will go and record the entire GI tract and transmit the images, which you can later on put in the computer and analyze and find out, and then go with the double balloon enteroscope and tackle that. We have world-class molecular biology laboratory here under an eminent specialist. This will cater to the needs of hepatology patients mostly. Similarly, we have, for example, in diabetic foot care, we have the latest technology here. I told you we introduced for the first time the insulin pump therapy in South India. The orthopedics department has a regenerative medicine department. You take out the cartilage from the patient, grow it outside the body in tissue culture, and replace it back to the patient, that kind of advanced system. We are the first to do peripheral stem cell transplantation for cancer patients here. And we were the first to do split liver living donor transplant. And we also do a lot of kidney transplant. And we were the only third center in the world after Barcelona and Ahmedabad to do kidney transplant by keyhole. It was not even done in US so far. So our specialists were specially invited to American Urological Association to present their video. And they were honored recently.
How at Lakeshore you make sure that we are up to date or up to the technology that is currently in market?
See, there is a culture of inquiry, enthusiasm, and scientific knowledge cultivated among the faculty of Lakeshore. We have selected eminent people who have this kind of attitude, and we select a particular person to learn a technology and bring it back to Lakeshore. We have started the latest electrophysiology lab in cardiology, and the consultant was one of the best available in the country. So we could take him into the fold, So similarly, we are actually concentrating on technology, identifying people, and send them to wherever it is best taught and bring back to Lakeshore.
You were talking about the cancer center, like the development in the cancer center area. So could you please brief about it?
Yeah, we already have a very large oncology service here. And we cater to adult and pediatric oncology. At present we have medical oncology, pediatric oncology, and surgical oncology. Because of lack of space, we have not been able to start radiation oncology. So that deficit is being corrected by a new block, which will the work will start soon. We hope to commission in 24 months time. That will house one of the leading cancer centers of the state,
Okay.
bringing the latest technology. Of course, we are doing peripheral stem cell bone marrow transplantation. Here, the allogenic bone marrow transplantation. From others, you take marrow and transplant, and also the gamma knife and whatever, the latest technologies and robotic surgery
Okay.
would be incorporated into the new block.
New block. The people around in Kerala, their lifestyle is changing very drastically. The way we eat, the way we behave in the society is creating a lot of new disease. So what Lakeshore is doing to help people to make their lifestyle normal or back to normal?
That's a very pertinent question you asked. Even though we are in the private sector, where the research facilities and all are lacking, we have a particular interest in studying the diseases pertinent to Kerala.
Okay.
My own research interest, I am currently the national president of the Indian Pancreas Club.
Okay.
So I work on chronic pancreatitis and pancreatic cancer. I had done a survey about this particular disease way back in 1992, and we have reported a lot about pancreatic, this so-called tropical pancreatitis leading on to pancreatic cancer and all, which is noted in the world literature now. So similarly, we have identified some diseases like hepatitis B and C related disease.
Okay.
Apart from that, we had actually adopted a village near Alway, West Kadungalur, with the help of the panchayat there, and went on doing a survey of the existing disease pattern of that, which is never done in the state so far. We go to the houses, and we may even attend house calls like the old time, medical practitioners. So a family medicine center would be established with the help of the municipality here. We already started discussion about that. We have a family medicine postgraduate program. We have DNB programs in many departments, and these people who are passing out from our own center are willing to participate in this program. So we identify their needs and the disease pattern, and depending on that, we intend to start a wellness solution center in the new block. That is also for international patients. That will also provide facilities for wellness solutions in the state for our own people. So we are actually charting out programs for that. So we will move into the society, rather than be a high-class hospital to treat diseases when they have occurred and then complicated and come at the last moment. As you said very correctly, we are intending to go into the nearby vicinity. That's what we can do as a private institution. But I am sure with the help of some agencies and governed by the NRHM and all of that, I have already started a discussion with the district collector here. He is very supportive. So we may extend this facility into the whole of Greater Cochin area. And we are known for the fast services. The whole world is now facing a problem of delayed medical treatment. Most of our directors, the board directors are from Middle East. Many of them have facilities there. They can offer us space or infrastructure for us to start feeder clinics. But I remember those days when 2 or 3 doctors started thinking of a 50 crore, 100 crore project. Nobody believed. That was in the 1995-96 period.